the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning to everybody who's watching. It is the 12th of December 2023. This is Stay Healthy, brought to you by the Nairobi Neurocare. On today's topic of discussion will be all about trigeminal neuralgia and treatment. And joining me in studio is none other than Dr. Mahendra S. How are you? Good morning, Doctor. How are you? I hope I said your name properly, Dr. Mahendra S. Chouhan. Yes, and today's discussion, as I've mentioned, is all about trigeminal neuralgia and its treatment. So just to educate whoever's listening, what exactly is trigeminal neuralgia?
Well, these are medical terms, so I would request our production team to focus on my presentation.
Yes.
Because it's something that people need to understand. And it's, unless I tell that, people will not connect.
Yes.
What problem it is.
Yes.
Yeah, so I'll wait for the production to connect with my presentation.
As we wait for them, I'm standing in for Gaddafi Yassin today, just so you don't miss him too much. Yes, and just to start off the conversation, just to remind the viewers, if they've got any questions, feel free to send a message, feel free to call us and engage with us on our social media handles. And as we go on with the show, we'll find out more about trigeminal neuralgia and its treatments, so feel free to share any questions that they obviously have so Dr. can answer them. I just wait
so
for
trigeminal neuralgia, for the common sense of people, is that it's the face. All of our body is divided into right and left half for almost every nerve supply, and we have some nerves. One supplies the sensation of the face, which is a very, very large representation in the brain. So this trigeminal nerve is actually able to convey each and every, even if you move a small hair on our skin, it will be conveyed to brain. So it's that sensitive. Facial sensations are very sensitive. So this nerve, which conducts all these sensations of pain, of touch, of anything on face, or inside the nose, inside the eye, inside the mouth, everything is conducted by trigeminal nerve. So why it is called trigeminal nerve? So that people don't need to remember this, I want to show my presentation. Yeah, so this is the one which is the representation. This is how the face gets a distribution. And so so if we see this one, we will find that there is a nerve which is called trigeminal nerve. Trigemini means anything which has got three parts. So it has got three parts, the first one, second and third one. So this is ophthalmic, maxillary and mandibular, so don't need to remember the nerve, the name of these distributions, but just that there are three parts through which the face is being supplied. And so this nerve is called, for this region, is trigemini or trigeminal nerve. And it's a very potent nerve, one of the largest nerve that the central nervous system has. And this gives sensation from everywhere. So if you're having a pain in your tooth, if you're having a pain in your inside of the mouth, if you're having pain on your tongue, pain in your eyes, everything is the function of this one. So when there is abnormality of this function, and so it starts carrying normal sensation and it conducts as if it was pain. So that's what is called as trigeminal neuralgia. So we can split the presentation with mine. I need that we see both of them. So me and the presentation.
Yes, Doctor, you can continue.
Yeah, so you can ask me the next question.
Okay, Dr. Now you've already shown us where the nerve is located. As anyone who's seeing, it's on the face, and you said it just causes, if you're having probably a toothache, if you're having your eyes are aching, it's probably it's located with the trigeminal nerve. And Dr. just to talk about what causes the pain. We know that you've already mentioned that the pain is caused by obviously the nerve over here. Let's talk about, I'm seeing you've already shown us where it's located. Let's talk about what can we help when it comes to soothing the pain.
So let's first start with the presentation, that how does it present and how people should know that they have got trigeminal neuralgia. Most of the patients who have this problem, they have pain in this region.
Yes.
And even it's situated deep inside. They cannot pinpoint the pain. So mostly they go to dental surgeons, and then many of them actually, it's very difficult to interpret kind of a presentation, because the pain, they see there is something deep inside. So eventually, unless now the dental surgeons know, but we have seen that on an average, for a person with trigeminal neuralgia to come to a neurosurgeon, the time is about 5 years, because before that they keep changing their dentists. Sometimes they even actually they remove their teeth. They just remove their teeth because there is so much of pain happening there. So for this reason, it gets late to present to us. But the very cause of this is that usually in about 0.5% of people this is there. But this is the nerve inside the brain which is actually coming out of the face and getting into the brain, because it's a nerve which is bringing in the sensation. So this is the outside, this is the inside of the brain, and the flow is from outside to inside. There are so many blood vessels around the nerves, but one of them just encroaches upon the nerve, and in the entry zone of this nerve it starts hitting it and pulsates, because all blood vessels are pulsating with the rate of the heart rate. So with each pulsation it hits the nerve, it rubs the nerve, and so this area starts getting swollen. And when it is swollen, then the even normal touch, most of the patients, they tell us that when they're washing their face or when they are getting a gush of the wind, it causes severe pain, and it is like a thunderbolt. It comes and then it goes back. So it comes with a few minutes, it will be like massive pain, and then it goes back. It is so severe that it was actually named as tic douloureux, which is also called as suicide disease. That people didn't know from where the pain is coming. Pain is extremely severe. No one was able to control. So people used to commit suicide out of it, out of pain. So that's serious and that's severe.
It is. It's
serious.
Doctor, you've already started giving us probably some of the symptoms. You've talked about it being a very it's like a pool. You've talked about it being very severe. What are some of the symptoms that if anyone has, you probably would say that it is trigeminal neuralgia?
So as I said, typical symptom is one which we cannot locate, but it is in general either here or here. We call them as V1, V2 and V3, but pain will be here or inside the cheek, inside the gums, and it will be pain is coming severely and then going back. Coming severely and going back, so that's why you call it thunderbolt kind of pain. And in severe cases, we've seen suddenly patients start weeping or shouting or trying to squeeze the cheek, and then suddenly becomes absolutely normal, as if pain was not there. This is a very typical symptom of trigeminal neuralgia. It can come from only inside the nose, can only come from the gums, but typically the pain is usually here. It can also be, though I've said that this comes mostly because of a blood vessel which is compressing, and that blood vessel is already there. It's just that there is a conflict between a blood vessel and the nerve. But it can also come with tumors, very rarely. So it will be starting late in life, and if the pain is increasing, say in 50s, then we also suspect the tumors in this region, which can cause this pain.
Yes. Victoria, let's talk about the terms trigeminal neuralgia and neuralgia. Is there a difference between those terms?
Any pain which is caused by irritation of the nerve or compression of the nerve is called as neuralgia. We have discussed it in the past that when headache happens, people said that we don't know from where the pain is coming. It can be from the deep inside the brain, but we renamed it as scalp neuralgias because it is coming from the nerves which are under the scalp, which are supplying the scalp. And so that's why anywhere where there is irritation of the nerve, compression of the nerve, then the pain which is conveyed to brain is called neuralgia. It is separate from a somatic pain or bodily pain, like if I get a fracture or if someone hits me on my muscle will get a contusion. Contusion is like accumulation of blood after local damage, and that pain is different. It can go by brufen, by diclofenac, but a neuralgic pain will not go by these ordinary painkillers. So I would request viewers that they should not take ordinary painkillers because the pain is serious and severe. They will keep taking more and more tablets, but it will not cause pain relief, and it will damage their stomach. So it is different from ordinary pain, and it requires a very specific medication.
Dr. when we're talking about treatment and medication, as you've mentioned, what are some of, if anyone's feeling pain, if anyone who's listening to this probably also, you know, these days people have turned to Google, they call it Dr. Google, where they go check in the symptoms and probably diagnose themselves already. So if anyone is going through what they term as trigeminal neuralgia, what are some of the things you would advise them to do?
Well, trigeminal neuralgia is something where the diagnosis is usually straightforward. Okay, and even the treatment is straightforward. Although the classic medicine that we practice, that we can give medications, and medicine is also, there is only 1 or 2 tablets which are actually going to work, but eventually all of these patients will have to go for surgery, and surgery is very, very simple. Yeah. So I would request that if they are going to a dental surgeon for the same problem, where there's electric like shock, it just comes and just suddenly goes away and you totally become pain free, then it is not a dental pain, because dental pain will remain all the time, particularly if you are chewing, although chewing can also trigger pain, but this pain has got a very typical phase of absolutely no pain. You will become normal. So if you have this kind of pain which is episodic, where you just don't feel pain, it is not dental pain. It is nothing else, but it is trigeminal neuralgia. So they should go to a nearby neurosurgeon for the treatment, because the treatment is surgical in most of the cases. Whether you wait today, you have to do it today or tomorrow. But absolute treatment, world's most successful treatment for this modality is surgery. Yeah.
Dr. when you mentioned surgery, what exactly should people be looking forward to? Obviously, surgery, somebody is thinking it's a very big procedure if I need surgery. What do you have to say about this?
Yeah, brain surgeries are actually considered always, I can never say the brain surgery are small surgeries, they are a few of the most difficult surgeries on the planet.
Yes.
But if you compare from a tumor surgery where you have to remove a part and cut the brain and remove the tumor, then there can be complications. But like if we are seeing here that there is a blood vessel, and then
we'll just get back to that.
There's a blood vessel, and then there is a, we just have to separate them, like two structures are fighting with each other, and we just have to keep a kind of a pallet in between. I keep muscle from patient's body going into its, so we take the muscle from the local area and we just put it there, and we have some tissue glue which we use. So it's a very simple surgery. It's a very anatomical surgery. So you are not going to cut the brain or do anything. It has got complication rates of less than 1%. So that's why I say that you go for medication, you keep taking medication, would have side effects, and still the problem is the blood vessel is rubbing against the nerve, and this will keep on increasing the swelling in the nerve. And if that keeps happening, then the pain is going to increase. So today you're taking 400 milligrams of tablet, tomorrow you'll have to take 600 milligrams, and so on. But it will keep on going. So eventually the chances of success for you are going to reduce if you are going for late surgeries. So I would always recommend early surgeries for my patients, because the treatment is very absolute. The success rates are more than 95%. So that's why I would always advise surgery to my patients, because very safe. In last 25 years of my surgical career, I've never seen a single patient getting a complication out of it.
Very, very well put. Dr. I know you had a diagram that you wanted to show us. I think we're going to go on our first break.
Yeah,
and then we're still coming back with surgery. I want you to take us through it step by step. So I think that brings us to the end of the first part of our show. We're going to go on a short break, but we're still coming back to discuss the trigeminal neuralgia and its treatment. So do not go anywhere.
HorizonTV, the beacon for the nation.
Quote of the day. Imam Muhammad bin Idris al-Shafi'i said, "To admonish your brother in private is to advise him and improve him, but to admonish him publicly is to disgrace him and shame him."
Ukipata matatizo, Mtume simama. Sio kudai kwamba mimi napenda Mtume sallallahu na kisha unaanza kuleta mambo ya bid'a. Utasikia hao ndugu zetu ukipata matatizo, kwanza wakisema sema Jesus Christ. Oh Jesus Christ. Ewe Isa nisaidia. Ndio maana yake. Nisaidia Isa. Na sisi leo tutapata baadhi ya Waislamu wakifikiwa na matatizo, neno la kwanza ya Rasulullah, wengine ya Ali, ya Hussein. Ilikuwa hofu yake kubwa ni kufunga ule mlango wa shirki. Unaona sahihi kwamba uchawi limekuwa ni jambo la kawaida katika jamii ya Kiislamu. Aina la ilaha illallah, iko wapi la ilaha illallah?
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
HorizonTV, the beacon for the nation.
Thank you so much for staying with us here on Horizon TV. This is Stay Healthy, brought to you by Nairobi Neurocare. As before we went on our break, we were discussing trigeminal neuralgia and its treatments, and Dr. Mahendra S. Chouhan was about to demonstrate how the surgery procedure is. And I think, Doctor, are you ready to demonstrate it?
Yeah.
Okay, perfect.
Just that I need my
so we're discussing about the surgery. You mentioned something earlier for anyone who's listening to this. You talked about the surgery rate and its success rate being very high. And I think I'll leave it to you to take us through.
So usually people are trying to avoid this. I'll just let you know that what are the treatment modalities.
Yes.
As a surgeon, I would always say that if you eventually have to finally come down to surgery, why don't we start with surgery? I was in a small town which has got a history of about 5,000 years, and I was practicing there in India, and I got a CEO of a very big company coming to me, and he said that I have this problem, and then I was saying that you are in Delhi, you are in such a big company. I don't think you have come all the way to show to me, because in Delhi there are so many options available for this procedure. So then he revealed that he has actually gone through some procedures before coming to me 7 years back. So first, something is called as radiofrequency ablation for trigeminal nerve. In radiofrequency ablation, which many patients do, and they come to me and I've operated them, and I can also do, by the way, is that intervention, but I choose not to do it because this is absolutely, I don't consider it to be the first line of treatment, and I would always try to offer the best for my patients, and I never want to see them back in my clinic coming with the same problem. So he had his RF ablation. So radiofrequency is something where you burn a tissue. So they are trying to burn a tissue which is the most sensitive nerve of the body, and what happens in the process, you are not removing something which is causing pain, which is basically a blood vessel over a nerve. They are trying to burn the nerve which is actually telling you, I am in problem, save me. Pain is always a signal to tell. If you got a heart pain, it is saying that I am getting less blood. So it warns you before that. If a nerve is getting compressed in your spine, it is warning you. So pain is always an alarm system of your body. You cannot shut your alarm down, because then it will not work. So you are trying to anesthetize the very nerve which is saying I have a problem because the blood vessel is over me. So you are not treating the cause, and it is just feeding on the fear of people of surgery. So you partially burn the nerve. Now the tissue is, the nerve tissue in the nerve is compressed by blood vessel, and now it is also partially burnt. How is it going to treat the condition? So I get patients who have RF where people have been gentle. Those patients, actually the RF fails and they come to us, and then we tell them surgery. Recently I did about 2 months back, very senior government official, and she was going to these societies, and there is a trigeminal nerve society in this country. There is a multiple sclerosis society. So they are going to these neurological society, and so many of them are so afraid of surgeries. Despite when I treated this patient, it was almost 10 years, and she has gone through the radiofrequency ablation, nothing happened. So they come to me, and then I have patients like this patient, the executive I was talking about. They did RF ablation, then it didn't work, pain returned, then did the surgery. Now you removed the offending agent, but you already burned partial nerve. So now because of that burning of the nerve, there is irritation. So now he never got relief after surgery, where the surgery has got 98% relief. So he didn't get it because he had RF. So once after seeing that case, I realized that I should never do RF in such patients, because that's not the true treatment. Then to just allay the anxiety of people of surgery, now we do it endoscopy assisted. And endoscopy is just 3 millimeter or 4 millimeter diameter. So you have to just make a hole behind the ear, and you have to go inside the brain by just retracting the brain. And when you go there, if my presentation can be on the TV, so as soon as you remove the part of the brain which is here, which is what we first saw. So now what we are getting is this view. You slightly press it and you get the trigeminal nerve, okay? And it can have various patterns. Red is artery and blue is vein. So you can have various configuration where you have to go there, and the only thing you need to do, you don't need to cut these vessels, you don't need to burn these vessels. You just put a pledget in between the nerve and the blood vessel, and that's all is required. It is just 1.5 hours of surgery, maximum 2 hours of surgery, and then patient can go back home on the third day. Yeah, patient can start eating food from the very next day, or if you're done in the morning, by night you are eating food, you're walking around. So, I mean, you need an extreme talent to mess with this kind of surgery.
Yes, clearly, clearly.
Because it's, as I said, it's anatomical surgery. You go there, you locate the blood vessel, which is so evident. You locate the nerve, and you have to insert something in between. People use Teflon. I use muscle, because muscle is body's own tissue, and there is no failure once you put the muscle inside. And then you put a glue, and then you come out and you close. So it's barely 2.5 centimeters, just like a coin. We call this coin craniotomy. So it's the opening in the skull, which is made, is as small as a coin, and then you go there with a stick, endoscopic stick inside. You are not doing anything damaging to the brain. So that's why people should not fear with these patients. And so many people who come to me, my prospective clients for surgery, I give them my relatives of the patients who are operated. I say, you talk to them, and they will tell you how easy it is. So, and then suddenly from the same day, the pain goes away. Yeah. So that's what we do. So it's very simple. It's nothing too much complicated to say.
It's not complicated. I love how you've mentioned the different treatments, but you've mentioned as well, surgery should be the first thing somebody should be thinking about. It's simple, it's quick, it's efficient.
That's what at least surgeons think.
Yeah. Dr. there's some people who assume that treatments like acupuncture can assist or help with the pain. What do you have to say about that?
Simple answer.
Yes.
If acupuncture was so successful, we would have multiple hospitals of acupuncture, not of medicine and surgery.
Perfect.
Anything which they say is good should have had, people would go to that, no?
It's true.
Why don't they go? Why don't we have big centers of acupuncture? It's always somewhere down some street where someone will be doing acupuncture.
That's true.
So that's because, I mean, it's simple business. If something is successful, people put their money into it, the big corporates put their money into it, they open hospitals, and then they bring neurosurgeons and spine surgeons and so many people. And they have huge operation theaters which cost billions. Yeah. So why there are so many hospitals if you go to Gong Road, you find Nairobi Hospital, you find so many hospitals lined up. Why not acupuncture centers?
Very well put.
Yeah. So I'm not an expert in acupuncture in the first place. I do believe that something can happen, but I believe that if the problem solution is straightforward, look there, don't look here and there. We have evidence of almost 75 to 100 years now. There are surgeons like Professor Janetta, who is considered the father of trigeminal neuralgia surgeries, has done more than 50,000 surgeries. And he is the one who has said that the success rates are more than 95%, and the complication rates are less than 1%. Even if I see my own work lifetime, I have yet to see a complication, touch wood. I've never seen, people always go on third or fourth day, and the kind of happiness that they get after the surgery is phenomenal. Yeah. So we can have anecdotal, I mean, I've got a psychiatrist friend who says that just by counseling, I relieve the patient, but psychiatrists do not have patients going in the first place to them if it was so successful. So I think that since the surgery is the most straightforward answer to this problem, and even as you can see from my presentation, the problem in itself is very simple. It is being complicated only by fear of patients.
It's true.
Yeah, and the fear for brain surgeries. I think in past 50 years, neurosurgery is the one which has become the most technologically and technically advanced. And now we have got so much to offer as neurosurgeons in our surgical armamentarium that we can practically guarantee a successful outcome of trigeminal neuralgia. So I would say, if you have these kind of symptoms, just go to neurosurgeons and get yourself treated. It's very rewarding.
Victoria, let's talk about any home remedies. People probably ask themselves, they've had the surgery and they've had acupuncture and they've had this, and they're probably wondering, oh, there's something I can do for myself at home.
So, not that, as I said, that average time for someone with trigeminal neuralgia to come to neurosurgeons.
Yes.
Now it is increasing because of social media and the research that they do. I mean, Google doesn't do all the time bad. It is the people who basically trying to be an expert when they are not. They think that if they have read 2 articles, they become an expert. But not only when you are doing a trigeminal neuralgia, you also have an expertise of operating a brain tumor or operating the spine at the same time. So you have that expertise of last 25 years. That's knowledge that you apply to process something which ordinary person cannot have. So they just have a symptom and they Google and they think that. But in general, home remedies fail. Although I had one patient, so as I said, it is about 95 to 98% success rate. That means there can be a failure rate of about 1.5%. Why is that? Because brain is bathed by something called cerebrospinal fluid, and it also pulsates. So it's logical that if there was a nerve and there was a blood vessel and there was a conflict and you separated them by a structure, mostly like a plagette of a muscle or a Teflon piece, it can actually be washed away by natural flow of this fluid. So for that we put a glue inside. Now even despite that, there is a failure rate in some patients which comes after about 7 to 8 years, and the only thing is you need to do is to reposit the same thing. Okay, so you have to again go there and do it. Some patient had a micro inflammation because of the glue that we used, although it is made by human blood. But some people had it, so that's why the failure rates were there. I had one patient who had this problem after 7-8 years, and he was a very poor guy from India. And then I was here and he called me. I said, I'm again having pain. I said, you need to do surgery again. He did some home remedy. So I can say that it's very simple. I don't know whether it works or not. I'm not vouching for it. But that patient got some relief. So I am not saying this is the treatment.
Yes.
But at least one patient got a relief. That he went to some Ayurvedic guy and he said, just put a lemon juice drops in your nose. And he did that and he had the relief. So I don't know how it works.
But he
because
still had to come back.
No, he has not come back.
Oh, wow.
That he called me about 4 years back during COVID times.
Yes.
So I believe in COVID times people had so much of mania and fear about so many things.
Yes.
So if you have existing pain or existing problem, it can get amplified.
Yes.
So I believe he had this COVID fear which turned into trigeminal neuralgia, and then someone said just put a drop and he got relief. But even today he is pain free. So I don't know, so I don't watch this treatment, but he had it. But there is as such no home remedy. For trigeminal neuralgia, the only thing I have seen, I will not say medical treatment, I will not say any other treatment but surgical therapy.
Surgical therapy. Thank you so much, Dr. I think that brings us to the end of today's show. We've talked about the treatments, and you've talked about the issue itself, trigeminal neuralgia. You've also mentioned to everybody who's listening the different cases and the different cases that you've also worked on, and its success rate, as you've put it, I think 3 times or twice. Like the surgery is 95% successful, and it's also simple and does not take too much time. So I think that brings us to the end of today's show. That was all about trigeminal neuralgia and its treatments. This was Stay Healthy, brought to you by Nairobi Neurocare. My name is Nadia Osman. Until next time, goodbye.